and I'm more at ease with my style of personality and my style of living. And that's especially so if I've had treatment. Treatment has an enormous positive effect.
Do you find generally that people follow through with their treatments?
Sometimes we come across the issue of compliance. And what do I mean by compliance? Compliance in treatment is the degree to which the patient is actually involved in the treatment. Sadly, we find situations where compliance is not as it should be. Cooperation with treatment, involvement in treatment doesn't occur at the level it should occur, and consequently treatment doesn't work out for that person. And I sometimes think the person doesn't fully appreciate that they're not really involved, they're not really committed at a level they should be, and they find it difficult to make that commitment. And maybe that may be a reflection of their personality or the difficulty they're having with treatment. But non-compliance is certainly a feature of treatment in psychiatry, and it's a challenge that we psychiatrists face again and again in the management of our patients.
Mm-hmm. So people, despite their illness and perhaps having had an appropriate treatment plan, not always following the advice that is given or the treatment plan that is given. I suppose we could say that that's the case in many things in life.
Yeah. We often have the best of intentions and take, weight loss programs. In January, half the world go on weight loss programs. By March or April, how many have stopped the program that they have, paid to get into? So that's human nature, and that applies to psychiatry as well. And it's a factor that it's important to recognize when we're looking at somebody who may not be responding to treatment.
So once a person gets out of their crisis phase, how would they manage their anxiety in the long term?
Once they have recovered from the acute phase, the crisis phase, one of the good things about treatment is you acquire skills. Well, you acquire, first of all, an understanding of anxiety, the nature of anxiety, how it affects you. In what ways have you been vulnerable? What are the factors in your life that have caused the anxiety? That's an enormous advantage, because once you're over the acute phase and you're living your life in the long term, as it were, you can use that knowledge as a preventative to prevent a recurrence. The psychological skills, the behavioral skills, the problem-solving skills. In addition to that, now that you're much more aware of anxiety, you can pick up signs of recurrence very, very quickly. And you can reconnect with your therapist. In addition to that, it's important that you have a sense that you're managing your mental health, that you're in charge of your mental health, and that you have a lifestyle that promotes mental health. Good diet, exercise, recreation, friends, and things like that are likely to keep you on the straight and narrow, as it were, for your mental health. Overall, that's the advice that I would give somebody if they would ask me that question.
It's interesting because in our society we're so focused on physical health and people focusing on going to the gym, working out, etc., diet, etc. But we don't always think about mental health that way, and managing our mental health and focusing on our mental health proactively. Although we hear more people doing that now, but it is interesting that we don't focus as much in that area.
That's very true. Yeah.
So if someone is diagnosed as having an anxiety disorder, would they always be a very anxious person, or might it be that over their life things get better, their anxiety levels go down? And partly I ask this because today's youth have such high levels of anxiety. And when you're young and you encounter your first big setback, your first big problem, you think the world is ending because it's your first big problem. You don't have the experience or the resilience. So can you comment on that in general? Does anxiety go down generally over a lifetime?
Generally speaking, as time goes on, we psychologically grow. The experiences of life, dealing with the adversities of life, generally speaking, has a creative effect. We psychologically grow, we mature, we're better able to cope, we're better able to appreciate the important things in life. And that's reflected in the rates of anxiety that we see in a community. For different age groups in the population, anxiety rates tend to drop from adolescence, 20s, 30s, midlife. There's a gradual decline in the rates. Now, that picks up again in old age, but up to middle age, you see that decline in levels of anxiety in the older age groups. And I think that's a reflection of the fact that we mature. We have a better idea of what we want from life. And even though I may by temperament be a shy, introverted type of person, by my 30s, I'm still shy and introverted, but I'm a less shy, a less introverted person. I'm more thoughtful. And because of the experiences of life, I have more confidence and I'm more at ease with my style of personality and my style of living. And that's especially so if I've had treatment. Treatment has an enormous positive effect in terms of our maturation, in terms of our psychological growth, because we have access to information, we learn coping skills, we learn to have a more objective understanding of ourselves that is enormously helpful in our day-to-day lives.
Well, it does sound hopeful. It's great to know that there are treatments available for anxiety disorders. And I think for our next talk, we're going to get into how anxiety disorders can impact your relationships.
Okay.